This program is rated GE. Content carried in here is suitable for general family viewing.
Welcome to Focus on Health, a show that informs you on matters health. My name is Boari Michelle. This week on Focus on Health, we take you through a cancer series. In our previous episodes, we've already demystified cancer generally and breast cancer, and today we focus on prostate cancer. Prostate cancer is a slow-growing tumor that is most common in men 50 years and above. But even before we see Daktari on that conversation, let us check out the feature of the day. That was the very informative feature of the day. With me on set is Daktari from HCG CCK Cancer Center. Our topic today, prostate cancer. So Daktari, thank you very much for joining us today. But even before we head down to our topic today, kindly introduce yourself to our viewers.
My name is Dr. James Mbogo. I'm a senior registrar at HCG CCK Cancer Center, here next to Mpisha Hospital along Shivachi Road.
Thank you. Daktari, let's head down to prostate cancer. How would you define prostate cancer?
Prostate cancer is basically a malignant or cancerous tumor that affects the prostate. The prostate is an organ only found in men. It's located between the bladder and the rectum. So normally we see prostate cancer. It is actually the commonest cancer affecting Kenyan men. Yeah, and the age is usually men who are in their 5th to 6th decades of life going up. And the risk of prostate cancer increases as you age. So a man who is, say, 90 years old has a higher risk of developing prostate cancer than a man who is in his 60s and 70s. Normally, we've seen even patients who are in their late 40s develop prostate cancer, though it's not so common. From around 50 years going up, then the risk starts increasing.
What are the signs and symptoms of prostate cancer? Rather, how does it manifest itself?
For all men, when we reach around age 50 going up, the prostate starts becoming big. It's something age-related. We call it benign prostatic enlargement. And when it starts becoming big, because of where the prostate is located, there's this small pipe called the urethra that comes from the bladder through which urine comes out whenever a man wants to pass urine. So sometimes, because of benign prostatic enlargement, the urethra can get blocked, and patients develop those symptoms of benign prostatic enlargement. These include waking up a lot at night to pass urine, increased frequency of urination, feeling like you've not completely emptied your bladder. So sometimes those are the same symptoms that prostate cancer may present with. Other times patients go for what is called screening. Screening is where you can go to have tests done to check for a disease, yet you do not have symptoms yet, to detect early disease. And most men have actually gone to do what is called a PSA, prostatic specific antigen. It's a blood test. They're found to have a high PSA. Then the doctor may tell them high PSA may mean you have prostate cancer. They go for further tests and they are found to have prostate cancer. So it may not have definite symptoms like, say, breast cancer, which may present with a lump, or bladder cancer, which may present with blood in the urine. Those are the symptoms we ask men to watch out for. Other times, unfortunately, some men present with cancer that has already spread. The favorite site of spread for prostate cancer is bone, especially the backbones. So a man may present with severe back pain. They may do tests such as a CT scan or an MRI. They are told it looks like they have something in the bone, which looks like it's cancer that has spread. And then further investigations reveal that it is prostate cancer. So the symptoms, the mode of presentation varies a lot. Yeah.
So Doctor, you've mentioned something about PSA. What is high PSA and what would you define as average PSA?
When we measure PSA in blood, the normal level has been reported in most labs as 0 to 4. Then the units they use is nanograms per milliliter of blood. So that a patient who, not another patient, a person who goes and has the PSA checked, then it's found to be maybe 6 or 7. Depending on the age, sometimes we may say it may be benign prostatic enlargement. The problem with PSA is also non-specific. If you have prostate inflammation, what we call prostatitis, maybe it's an infection, it may go up. If you have prostate cancer, definitely it will go up. If you have benign prostate enlargement, it may go up. But we have seen very high levels, such that when we see a level that is above 10, we really suspect it may be prostate cancer. A high PSA does not diagnose prostate cancer. I want to clear that. Even a high PSA does not mean you have prostate cancer. Because how we screen for prostate cancer, even normally, is we will do a PSA, yes, which is a blood test. Then we have to do what is called a digital rectal examination, because the prostate is located in front of the rectum in men. So digital rectal examination means the doctor has to put a gloved finger inside the rectum and then feel for the prostate. If it's enlarged, if it's the texture, then all those may point towards, so that he may see the way he feels the prostate when he does the examination, and then a high PSA, he may recommend further tests. Like he may say, let us do what is called an MRI of the pelvis. Then the radiologist will report the prostate and say, yes, this prostate, it looks malignant. Then the final test called a biopsy, which is also done through the rectum, where they take small pieces of the prostate. That is what will confirm whether a patient has prostate cancer or not.
Dr. You've mentioned something about breast cancer, and as I was doing my research, I came across something about breast cancer having a link to prostate cancer. So if a man has breast cancer, does that, predispose you to prostate cancer?
Breast cancer is, we see it in men, it's very rare, but there's another gene. This one now I'm getting a little bit more technical. There's another gene, it's called the breast cancer gene, or BRCA, BRCA, and we have 1 and 2. Now, when a patient who has a strong family history where there is a BRCA gene in the family that is mutated, that means an abnormal BRCA gene. Say a lady has breast cancer, and then we find that she has a mutated BRCA gene. If we check the same BRCA gene in, say, her brothers or her father, and we find it's mutated, then they have a high risk of developing prostate cancer. And please note that we are saying, even women who have a mutated BRCA gene, it does not mean they will get breast cancer or any other cancer. Maybe even ovarian cancer has been linked to the BRCA gene, which just means that their risk is high. So we may tell them they need to do screening more frequently. For breast cancer, we tell them maybe a mammogram, maybe annually. And then for prostate cancer, it may be what I mentioned, the digital rectal exam and the PSA levels. It does not mean that they will develop. They just have to be very, very vigilant, the symptoms I have mentioned, and then doing screening very diligently in a very disciplined manner, so that, because screening detects early disease, so that if it's detected early, it's still curable. That has been the link because of that one mutated gene called BRCA or BRCA, and we have BRCA 1 and 2.
Dr. Let's talk about the causes. What exactly causes prostate cancer?
The cause is unknown. So we talk about risk factors. And a risk factor is an attribute that increases the risk of, or the chances of you developing a particular illness. So like I mentioned, age. The older you are, the higher the risk. There's also family history, such that maybe if your dad had prostate cancer, then your risk is also high. Okay, or what we call first-degree relatives. Like if your father had, then maybe the siblings and the brothers and maybe the grandfather, that they may have a higher risk of developing prostate cancer. Eating a lot of red meat has also been linked. And remember, these are risk factors, and these are the few that we know. So we cannot say that even if you eat a lot of red meat, you are obese, your father had prostate cancer. It does not mean you will get prostate cancer. It just means that your risk is high. So you can alter your lifestyle, reduce maybe your red meat intake, and you start exercising. That will lower your risk. Your father having prostate cancer, you cannot change anything about that. That is what actually we call a non-modifiable risk factor, what is family history. So we'll just encourage you, go for screening. Digital rectal examination and PSA levels.
Doctor, you've talked about obesity. Does that mean that if someone is obese, that would actually predispose you to prostate cancer?
It may predispose, but it doesn't mean if you have obesity, you will develop prostate cancer. It's just a risk factor. Yeah.
Thank you very much, Dr. Hold on to that thought. We are going to take a slight commercial break, and when we come back, Dr. is going to be telling us more about the treatment and diagnosis of prostate cancer. I will leave you with the Did You Know segment.
KUTV, in conjunction with Kenyatta University Funeral Home, is now offering death announcements immediately following our news bulletins at 7 p.m. At this sorrowful time, as you share in your grief, allow us to communicate your announcement of your loved one on KUTV in both Kiswahili and English. For more details, kindly inquire at the KU Funeral Home Service Desk or call 0736 928 380 or dial 020 359 9054.
Nothing worth the gain you attain by sudden blood. Don't you know that I still care for you? Me flip-flop got me needing more and more of you. Gonna be the one to catch you.
Far East, welcome to the Empire. Far East, we call it find true love. You will see what your love has done for me.
Called academic ignorant.
I am at Power Governors Limited to talk about governors that have power.
When the new speed governors were introduced, this country did not have a standard. They would put in a tamper switch so that the speed governor will only operate well when there is likelihood of being caught by police.
So when we give a solution to our customers, we'll be giving them the speed limiter, the tracking they can be able to monitor, also fuel management.
What you see here, this is the fuel level sensor. It is what is used to detect the level of fuel that is in your tank.
Napoongea sahi, nitakushangaza nikwambia sahi sina ndizi, na ni kwa sababu ya soko. Soko iko mingi.
Welcome back to Focus on Health. In case you're joining us right now, our topic today is prostate cancer. So, Daktari, tell us about the investigations. How do you work up the investigations once someone is already diagnosed with prostate cancer?
So once we have a biopsy confirming that a patient has prostate cancer, like I mentioned earlier, prostate cancer tends to spread a lot to bone more than any other site. Most solid tumors spread to the lungs, the liver. But prostate cancer has this unique habit of spreading to the bone. If possible, we do what is called an MRI of the pelvis, just to look at the prostate, the local extent. Is it in how big is the mass in the prostate? Is it invading the bladder and the rectum, which are the surrounding organs? Is it invading another small organs we call the seminal vesicles, which are also found just below the prostate? Because all that helps with what we call staging. Then there is what we call the lymph glands. We have them found everywhere, the neck, above the collarbone, the armpit, in the chest, in the abdomen, and even in the pelvis. And sometimes the ones that are found in the pelvis or just around the organs inside the pelvis, such as the bladder, the rectum, next to them, the prostate cancer can spread to them as well. Again, that helps with our staging. Finally, especially for patients who have a high PSA level, and a high PSA mean like more than 20, or they have symptoms, maybe they have back pain, severe back pain. We do what is called a bone scan. This is a unique test where they injected with some radioactive material. Then we take a scan to look at the entire skeleton. We want to see whether the cancer has spread to the skeleton, if it has, or to the bone. All that helps with our staging. So finally, we will stage the patient because we have from stage 1 up to stage 4. And the staging is what determines the treatment that we will give. So patients who have early stage disease, we have so many options in prostate cancer. We have surgery, we have radiation therapy, we have hormonal therapy. Hormonal therapy, because prostate cancer, especially what we call prostate adenocarcinoma, it is a hormone-dependent cancer. It needs the male sex hormone, testosterone, to grow. So, and it is actually, when I said that prostate cancer is the commonest cancer we see or rather it's commoner in old men than in younger men, we're talking about that prostate adenocarcinoma. So when we see the biopsy confirming, yes, this is prostate adenocarcinoma, we've staged the patient. Then we tell the patient these are the treatment options available. A patient may opt for surgery. Some patients may say I don't want surgery because of the complications of surgery. Some patients may say we want radiotherapy, where we use high energy X-rays to treat the tumor. Some patients may, the ones who we do radiotherapy, we normally combine with hormonal therapy. Surgery, normally we just remove the prostate and the seminal vesicles and what we call the lymph nodes. It's a surgery called radical prostatectomy. And then again, that will even help with further staging because it will tell us the extent of the disease. MRI may have said the lymph nodes were involved, but because they'll have removed the lymph nodes, they take them to the lab. The doctor in the lab, the pathologist will look at them and say, no, they were not involved. So that will actually confirm the stage. Interestingly, because prostate cancer is what we call it's an indolent cancer. It's a slow-growing cancer. Sometimes we may get a patient maybe who is 90 years old with a stage 1 prostate cancer and may have maybe multiple other diseases. Remember, the older you are, the higher the chance of even having other diseases like high blood pressure, diabetes, kidney disease, strokes, heart attacks. So we may find a patient who has what we call multiple comorbidities with a very early stage prostate cancer because we classify it according to the risk. We have what we call very low risk to very high risk. In such a patient, we may even opt to just do follow-up. Yes, they have prostate cancer, biopsy has confirmed, maybe PSA was 7 or 8, but they have stage 1 prostate cancer. And then they may be taking many other medications. We may tell them, let us just follow you up. Every year we'll be checking your PSA. We may do another biopsy to check if the cancer is becoming more and more aggressive. But we tell the patients these are the pros and cons. If we decide to follow you up and not treat, maybe in that 1 year follow-up the cancer the biologic behavior may change, it may become more aggressive and spread. But also if we do not give you treatment, we are going to minimize the side effects of this treatment for you at this time. But prostate cancer is like one of the few, it's the only cancer we can actually do that, where we can do what is called watchful waiting. We do not treat. And it's not all patients. It's only a few patients who present with very early stage and what you call very low grade disease or very low risk disease.
So Dr. if I'm getting you correctly, if one is diagnosed early, does that mean that you can actually get a cure? Are there survivors of prostate cancer?
We do. We have prostate cancer survivors, even the ones who presented, say, with stage 3 disease. Because they come, we have staged, we found we staged and we found that whatever stage they were in, and the patient says, I do not want, like in this center, for instance, here we offer chemotherapy, hormonal therapy, and radiation therapy. We don't do surgery. Surgery I have to refer to a specialist called a urologist. So a patient says, I just want to, I opt for the option of radiation therapy. So we'll combine radiation therapy with hormonal therapy. Radiation therapy is given daily for about 7.5 weeks, every day except weekends. And like I said, we're using high energy X-rays. Most of us have done an X-ray one time of our lives, maybe for the chest or a bone or whatever. Here we're using what are called high energy X-rays. We focus them on the prostate or the pelvis so that we also treat those lymph glands. And then we treat for about 7.5 weeks to completely eradicate the treatment. At the same time, we're combining with hormonal therapy, which comes in the form of tablets and an injection. The injection is given every 3 months. We inject on the tummy. Now, the main purpose of this injection, like I said, we want to reduce the levels of the male sex hormone, the testosterone. So literally what we are doing, we do what is called chemical castration, because you're going to reduce the testosterone levels to very low, nearly undetectable levels. At the same time, so the testosterone level will drop, and as we're giving even the radiation therapy, even the PSA level will drop. Even patients who've come with PSAs of even 100, they drop down to even less than 0.01 because it responds very well to treatment. After they finish the radiation therapy, which is nearly 2 months because 7.5 weeks or 7 weeks minimum, they continue with the hormonal therapy. And the duration of the hormonal therapy, it can range from 6 months to even 3 years, depending on the stage. This treatment has side effects. We cannot escape the side effects.
For the radiation or chemotherapy?
All of them. Let me start with the radiation, because where we are treating, in front is the urinary bladder that carries the urine, behind is the rectum that stores stool. So initially, as we start treatment, the patient is not going to experience anything because we are giving them a small dose of radiation. But maybe from around the 3rd, 4th week of radiation, the patient will start complaining when they pass urine, they have pain, they may see blood, They may have frequency of urination. At night, they may be waking up a lot. When they go for a long haul, they may have diarrhea. Stool may have blood or mucus, or it may be painful. And we normally have medications we give to manage these side effects because we do not want the treatment to be interrupted.
Dr. You've already talked about some of the side effects of these treatment methods. So let's go to hormonal therapy. Is it true that it actually causes erectile dysfunction?
Yes, it is true. Because when we give hormonal therapy, we normally give to suppress the male sex hormone testosterone. And it's the one responsible for sexual activity, including libido in men. So when we give a man that injection, it suppresses about 95% of testosterone levels in men because we want it to literally stop feeding the growth of the cancer. And while the man is going to respond very well and the cancer will be well controlled, the side effect that's going to cause, it's going to cause erectile dysfunction. It can even cause impotence. The penis can shrink, can become smaller. The breasts in men will become bigger, what we call gynecomastia, and sometimes they can even become painful to an extent where we have to give a man radiotherapy to ease that pain. Yeah.
Now, Dr. Let's head down to the prevention methods. How do you prevent prostate cancer?
Preventing prostate cancer is because we do not know the cause, like I said. So it's quite a tough question that you're asking. So we may tell a patient, or rather members of the public, cut down on like red meat intake. And remember, red meat is not just cutting down to lower your risk of prostate cancer. Red meat, high consumption of red meat has been linked to other illnesses as well, colon cancer, cancer of the rectum, these other non-communicable diseases like hypertension. So it's not just an issue of what you call gout. So it's not just an issue of just reducing to lower your risk of prostate cancer. Reducing your intake of red meat is going to help you reduce the risk of developing other diseases. And please note, I'm saying reducing your risk, not preventing. But the good thing about prostate cancer, it is a disease that we can screen. So we'll advise men from age 50 and above, start going for regular screening. See your doctor, see your physician, see your urologist if you have one. He can do the digital rectal examination and request for a PSA. So that if the disease is found early, it can be cured.
What would you tell, people living with prostate cancer, rather the family and friends, how do they cope, with the management of prostate cancer?
I would tell them, when found early, it's a curable disease. Again, even when found late, like when it has spread, we've had patients even with prostate cancer diagnosed that has spread to bone, and even 4 or 5 years later, they are still alive. On therapy, yes, and even experiencing the ravages and the side effects of treatment, but still alive because it's controlling their disease. We can't predict who will respond and who will not, because unfortunately some patients we found with prostate cancer, we've started them on treatment, but a year later they have passed away because sometimes the disease tends to become very aggressive. But they still hope, even if they have cancer that has spread, they still hope for them. And for the family members, we tell them, please understand the side effects, especially for the hormonal therapy. They're not easy on men. They're not very easy on men when they start losing their sexual function. Another side effect is that they become very irritable. Not because they want to, it's just a side effect of the hormonal therapy. So we tell them, please understand, when you have a parent or when you have a spouse or a parent or a sibling with prostate cancer who is undergoing treatment, just support them and be there for them.
Thank you very much, Dr. It's been quite an informative session.
Thanks for inviting me, Michelle.
So you've come to the end of our show, and there you have it from Dr. Prostate cancer has a silver lining. I've been your host, Michelle. I will leave you with the healthy segment. Until next time, stay healthy.